Welcome to ENT MCQs Part-2. So, let's begin. Question number 7. Kisselbach's plexus is formed by all except Option A. Anterior ethmoid artery. Option B. Septal branch of superior labial artery. Option C. Septal branch of sphenopalatine artery. And option D is lesser palatine artery. So, the correct answer here is option D. Lesser palatine artery. Kisselbach's plexus or Little's area. This is the vascular area in the anterior-inferior part of nasal septum just above the vestibule. This plexus is formed by anterior ethmoidal artery, sphenopalatine artery, greater palatine artery and septal branch of superior labial arteries. So the correct answer here is lesser palatine artery. Next question. Question number 8. Weim test is useful in option A. Venous granulomatosis, option B. Sarcoidosis, option C. Churg-Strauss syndrome, and option D is eosinophilic granuloma. So the correct answer here is option B. Sarcoidosis. Weim test, also known as Nickerson-Weim test. It is a skin test used to detect sarcoidosis, where part of a spleen from a patient with non-sarcoidosis is injected into the skin of a patient suspected to have the disease. If non-caged granulomas are found 4 to 6 weeks later, the test is positive. But if patient has been on treatment, for example on glucocorticoids, the test may be false negative. Next question. Question number 9. Floating palate and teeth is seen in option A. Left foot 1 fracture, option B. Left foot 2nd fracture, option C. Left foot 3rd fracture, and option D. Naso-orbito-ethmoid fracture. So the correct answer here is option A. Left foot 1 fracture. Left foot 1 fractures are essentially a separation of hard palate from the upper maxilla due to a transfer fracture running through the maxilla anterior plates at a level just above the floor of the nose. Next question. Question number 10. Most frequent site of branchial cyst is a option A. Upper third of posterior border of sternocleidomastoid muscle, option B. Lower third of anterior border of sternocleidomastoid muscle, option C. Upper third of anterior medial border of sternocleidomastoid muscle, and option D is supraclavicular fossa. So the correct answer here is option C. Upper third of anterior medial border of sternocleidomastoid muscle. A branchial cleft cyst commonly presents as a solitary painless mass in the neck of a child or young adult. They are most commonly located along the anterior border and the upper third of sternocleidomastoid muscle in the anterior triangle of the neck. Next question. Question number 11. Tuberculosis of larynx most commonly affects option A. Posterior part of the larynx, option B. Supraglottis, option C. Anterior part of larynx, and option D is Subglottis. So the correct answer here is option A. Posterior part of larynx. TB of larynx is almost always secondary to the pulmonary tuberculosis. It mostly affects the male in the middle age group. Tuberculosis bacilli reaches the larynx by bronchogenic or hematogenous route, and disease affects posterior part of larynx more than anterior. The parts affected are intra-arytenoid fold, ventricular bands, vocal folds, and the epiglottis in that order. Next question. Question number 12. A 30-year-old woman with family history of hearing loss from her mother's side developed hearing loss during pregnancy. Hearing loss is bilateral and slowly progressive, with PTA showing conductive hearing loss with dip at 2000 Hz. What is the most likely diagnosis? Option A. Acoustic trauma, option B. Acoustic neuroma, option C. Meniere's disease, and option D is otosclerosis. Here in this question, you need to note that there is a family history and patient is having the hearing loss during pregnancy. Hearing loss is bilateral. In PTA, there is conductive hearing loss with dip at 2000 Hz. And these are all the features of option D, otosclerosis. This is a pure tone audiometry of a patient with otosclerosis. In this, you can see that there is a dip at 2000 Hz in bone conduction, which is known as the Carhart's notch.